Okay guys, I'm going to show you how to hook up a ventriculostomy and get it all ready for the surgeons. So a couple of things that you're going to need before you get started would be your neuro cart. You can also grab the Camino because in the back of the Camino you're going to have your red ViewLink box, which you're going to need to hook up your ICP monitor. Something else you might need would be a pad. Sometimes when they're drilling you can have a mess. So putting this under the patient's head before it gets started would be the best if you can. Also 2 sterile red caps, pressure tubing, and then this is a sterile procedure, so when setting this up you need to be wearing sterile gloves. So when the surgeon gets here, you're obviously not going to be alone. Somebody's probably going to be holding the head and helping you assist with the setup. So the first thing you're going to do is come down here to the very bottom of the arm and you're going to grab the intracranial access kit. It's a big box. You're going to hand it to the surgeon. Just remember that if they ask for lidocaine with epi, it is in the Pyxis, so you may have to grab that. Next, you're going to come over here to the side of the cart, and you're going to grab the ventriculostomy catheter. The small ones are antibacterial coated, the large ones are not. It's just provider preference. The sizes are on the boxes, so whichever one the provider wants, you'll just give that to them. In the meantime, as they're getting all that ready, you're going to grab this top box here, which is called the Becker drain. This is what your Becker drain looks like. So, whenever you're getting this set up, you're going to come over here and you're going to grab your art line kit. You only need this piece of the art line. So you'll break it down and you'll attach it to the end of this ventriculostomy or the Becker drain. Okay. Then you're going to come to the second drawer. You're going to grab a 30 ml syringe, which I already have open, so I'm just going to use this one. And you're going to grab some preservative-free saline. You'll use your blunt tip needle to draw up 30 ml of preservative-free saline. You will come over here, and on the art line portion of the port, you're going to attach your syringe. You're going to prime all of the tubing here. So you can turn it this piece to the left, and if this piece is down, you're going to prime over here. Once it's turned this way, you'll prime all the way to the patient. And somebody will be holding the end of this. Obviously, this needs to be a sterile technique, so they need to be wearing sterile gloves as well, but being prepared to attach that when the surgeon is ready. You also need to come over here and prime to the transducer. So that'll all be primed. Once that's all primed and your surgeon's ready, sterilely, we'll hook this up. This will be in the patient's head, and then they'll tell you how to dress it. Then you're going to come over here. We're going to turn this off. You can take your syringe off. Leave that on for just a second. You'll put your ViewLink box here. You'll attach your pressure cables. And then you can take this off. We're going to turn it off to the patient side, and we're going to open it to the system, and we're going to zero it like we would an arterial line. So, if you see up here, this is labeled ICP. If you're not seeing this up here, you can come down to what we call the caterpillar. Just make sure that you activate that ViewLink box, and just make sure it's labeled ICP. So you'll come over here, and you're going to zero ICP like you normally would. Once you get a 0, you can turn that back off. You'll grab 2 sterile red caps, put them on the ends, and then you're going to cut off that pigtail because you're never going to flush this system. Our standard says that our normal ICP needs to be between 0 to 15. Anything greater than 20 for more than 5 minutes is a medical emergency. We probably need to be calling the provider at that time. And that's pretty much it. Just making sure that anytime you move this patient, turn them, the head of the bed goes up or down, you have got to turn this thing off to the patient. So you can either do that by coming here and turning it off, or you can come here and turn it off to the patient. Just make sure it's turned off because it can increase the CSF that's draining out. Once it's all placed, the surgeon will tell you where to place this barrette, and all of this needs to be zeroed to the tragus of the patient's ear. Once that's all done, you can come up and you'll set that to whatever the provider wants that set at. In order to drain it, you'll just open these clamps. Usually it's every hour unless otherwise indicated, and you'll drain and monitor your CSF. If you would need to change this bag, say it gets too full, it's in here, which we don't have any, but there's a box in here. You can always call OR distribution and grab that. Oh, sorry, it's right here. And that's it.